Hello, good morning, friends. I am Dr. Vinod Kulkarni, psychiatrist in Hubli. Today, let me tell you something about what is called as e.c.t. What is the long form of e.c.t? It is called as electroconvulsive therapy, also called as electroconvulsive treatment. Unfortunately, if I am not wrong, it's a misnomer. Neither do we give electrical shock to the patient, nor does the patient get convulsions. It was two scientists, Serletti and Binney, who about 100 years ago invented this novel mode of treatment, the great therapeutic modality to undo certain mental illnesses of the psychiatrically affected population. People think we give shock. No. No psychiatrist ever gives shock to any patient. On the contrary, we pass electrical energy in the brain. Patient is completely unaware of it. He is anesthetized. Just as before undergoing a surgical procedure, the anesthetist comes and gives anesthesia, makes the patient unconscious. Similarly, when we do e.c.t, we do it under general anesthesia. It's a teamwork. An anesthetist comes, the staff comes, nurses come, ayahs come, ward boys come. The head of the team, of course, is a psychiatrist. Anesthetist gives general anesthesia and psychiatrist gives what is called as modified e.c.t. How many treatments are required? 6 to 8 treatments are required. How frequently we have to give? We have to give on alternate days, first 4 treatments. Then we give a gap of 4 days, again give 2 treatments on alternate days. What counts is not how many treatments you give, not how many e.c.ts you give, but what counts is how frequently you give. Adequate spacing has to be done in between 2 e.c.t treatments. Here, in e.c.t, we do what is called as brain stimulation. We never ever give shock to the patients. Please avoid that conflict in your mind, that disbelief, that dispute in your mind. In the e.c.t suite where I am standing, we have all the machines here. This is the e.c.t machine. These are called the electrodes. This is the anesthesia station. I am very happy to say that our Manas Institute is one of the very, very few psychiatric institutes in the country wherein we have all the facilities. We have anesthesia station. We always give e.c.t with the aid of anesthesia station. We have a defibrillator also in the unlikely event of any patient developing cardiac arrhythmias. Though, of course, in my 45 years of experience, I never have encountered any case of cardiac arrhythmias after being given e.c.t. This is a cardiac monitor through which we measure. We constantly keep a vigil on patients' heart rate, pulse rate, respiration, and blood saturation of the oxygen. This is the entire e.c.t suite. I'm just making you to realize this. Yes, these are the machines which I told you about. And what are the indications for e.c.t? First indication is severe depression. Number 2, suicidal ideations or unsuccessful suicidal attempts. You must give e.c.t. Schizophrenia, catatonic schizophrenia, wherein the person becomes mute, doesn't speak at all, doesn't eat at all for days together, refuses to pass urine, refuses to empty his bladder contents. In such cases, you must give e.c.t. also. In mania, we give e.c.t. But the wonderful therapeutic modality which I want to emphasize, which I want to stress is that in parkinsonism also, e.c.t. is a great beneficial treatment. I'm very happy to say that our general physicians, our general practitioners, our neurologists have realized the importance of e.c.t. in their parkinsonism patients, and they do convince their patients, look, you have severe depression, you have side effects of parkinsonism, I put you on syndopa, it is producing hallucinations, please take e.c.t. I'm happy at the latest development prevalent in our society. There are some people who ask for what is called as maintenance e.c.t. They say, Dr. Saab, we are tired of medications. Please don't put on medications. We are unhappy with the adverse effects. Instead of that, please give me one e.c.t. every month. It is called as maintenance e.c.t. That also is a great therapeutic modality. 6 to 8 treatments we give. And some people ask me, why not drugs, doctor? Why e.c.t.? I give them an example. If you want to go to America, if you want to go to America by car, Ettina Bandi, it takes years and years. Whereas if you want to go to America by a flight, by an aeroplane, it takes only about 18 to 20 hours. e.c.t. is like that. It acts with jet speed, very fast. Medications take anywhere between 2 to 3 months to commence their action. If you want a speedy relief, if you do not want adverse side effects of medications, plus if you want to save patients from severe depression and suicidal ideations, please do resort for e.c.t. Contraindications, nothing. Patient's heart, cardiac condition, patient respiratory reserve should be good. The only contraindication, if I may tell, is that the patient has a brain tumor, an SOL, a space occupying lesion in the brain. Please avoid e.c.t. This is something about the novel therapeutic modality, e.c.t. Never ever hesitate to prescribe e.c.t. for your patients who are severely depressed or who are severely suicidal. It is a new ray of hope for the suicidal patients. All the best. God bless you. Thanks a lot.